one ever thinks they'll get the diagnosis of cancer. I never thought so. I'm like, okay, I'm an oncology nurse. I know what to do. Never did I ever think that I would be on the other side. After about 3 weeks, probably or so, of working here, I had found a lump. So I was able to, within a couple days, get the mammogram scheduled, the ultrasound scheduled. I had actually had this done at a different facility because at that time that's where my medical care was. I noticed a nurse navigator walking through the waiting room to the back when I was in the waiting room, and I knew who she was, and I knew she was a breast navigator. And I told my mom, she's here for me. Like, they're gonna tell me I have cancer. So we walked back, and I had cancer, and the radiologist just kept saying, she just threw out chemo, radiation, surgery, all this stuff, and how the navigator would work. And I said, whoa, stop there. I work at Franciscan. I need to transfer my care, and I need to process this a minute. From there, it rolled really fast. So the biopsy, the results, meeting with the surgeon, and then finding out that because of my HER2 positive, I would need to start chemo right away instead of surgery. But we needed to get a scan. We got a scan, we got a PET scan. It showed a spot on my hip bone, and then it came back that it was positive. So I had stage 4 metastatic at that time, which is what they say, not curable. The Dr. Ortiz, I told him that I wanted to do everything. I didn't necessarily have to, maybe, but I wanted to be aggressive. I had a not quite 2-year-old at the time. Currently, I have no evidence of disease, and I feel great. But at the beginning, I never even really thought I would be here. I just feel like if I had to go through it, it needs to be for a reason. And my reason is to help others get through their journey and their hardship. For everything to be more centered, localized, that communication piece because you don't just have an oncologist, you don't just have a surgeon, you have so many things that are wrapped up in your cancer care, that why not wrap it all up in more of a localized and help that patient too. So I think from a nurse standpoint, it'll help us give better care. I'm hoping it'll help ease some stress on those patients, because it is difficult sometimes to go over to one building and get something done, and then come back here and move around from different places, and also knowing where you're going, that can be stressful. I've seen patients, it's like on top of everything else they have to remember where to go and who they're seeing that day and things.